Thank you very much, Amy and Fred, for inviting me to speak today. My name is Deepu Nair. I'm the Medical Director of the Echocardiography Lab at El Camino Hospital and El Camino Health. And I am here to speak to you today about innovations in cardiology, specifically relating to cardiac imaging. So I like to think of this more broadly. For really thousands of years, humans have been thinking about how it is that our bodies work. And in many ways, we're visual creatures. More than almost half of our brains are devoted to visual processing in one way or another. And historically, the only way we could figure these things out was to dissect and try to solve things that way. But in the past 50 to 100 years, technology has finally allowed us to image the body and the heart specifically in this context with non-invasive means. So today I'm hoping to give you just sort of a high-level outline of some of the cardiac technologies we use to image the heart, which allow us to do some of the amazing things you'll be hearing about during the day today, including by Dr. Ramahan shortly. So I'd like to start with something that's close to my heart here, which is, pun intended, I guess, echocardiography. So echocardiography is using ultrasound technology to evaluate how the heart works. Many of you are familiar with this perhaps from prenatal ultrasounds during pregnancy. It's the same idea, using ultrasound to image the heart, and it's really the workhorse of a cardiology department. And this technology has a number of positives. First off, it's non-invasive, it's fast, it's quite accurate, and it's portable. And the last 10 years have seen a real explosion in the technology that's available for echocardiography. Now we are able to image in real time, three-dimensionally, the heart. And so some of the images here on the top right, for example, is a three-dimensional image of a mechanical heart valve, which is the circular thing there. The two posts are the mechanical leaflets of this valve. And we can image that in real time, which allows us to really think about it in a much more creative way than we did before. The bottom right is a closure device used to close a congenital hole in the heart, and you can see its sort of circular profile. Another special type of echocardiography is called Trans-Esophageal Echocardiography, and this is where we place the probe in the esophagus, allowing us to take pictures while someone is, say, fixing the heart. And this has been used for decades now in cardiac surgery to see how a surgery has gone. We're now using it as part of the structural heart team to look at the heart when we're doing minimally invasive procedures as well. This brings me to the idea of the structural heart team, which really is to find a collaborative team to help with complex procedures. At El Camino Health, we have teams composed of a number of people, only some of whom I've listed here, including a structural interventionalist. This is a cardiologist with special training in minimally invasive valve procedures, for instance, a cardiac imaging specialist, a heart surgeon, an anesthesiologist, nurses, administrative staff, and this whole team comes together in order to provide the best possible outcomes for the patient. Another type of technology that we rely on heavily is CT technology. Historically, when we ask the question, am I at risk for heart disease, what we've done often is stress testing. Many of you may have heard of this or had one yourself. A stress test is a useful test, but it has certain limitations. Using a simple CT scan without contrast, called a CT calcium score, we can actually image the arteries, and in that top right image, you can see that we can image calcium in the arteries, which is a sign of plaque buildup. If you have calcium in your arteries, it means that there is plaque buildup, and we should be working on minimizing your risk of future cardiac events. A more detailed type of CT scan is called a CT coronary angiogram, and this is something we heavily rely upon these days. This is a fancy way to image the heart with contrast in order to see the arteries of the heart in a non-invasive way. On the right image here, is a picture from an angiogram, which is an invasive procedure where we inject dye in the arteries. And the left image is actually the same patient, same artery, and the arrow points to the same area of narrowing, which I think you can see the artery looks pinched there. And these types of images allow us to assess the heart arteries without the need to do something invasive right up front. And the accuracy and resolution of these images has really improved over the course of the past decade or so. We can also expand the window of a CT scan and image the whole body. This is actually an image on the left, is an image of a person subtracting everything except for their blood vessels and some of their organs. And you can see how we can image the body, and then on the right side, we can slice this image into different planes and make measurements which allow us to design our procedures for the heart. One other important question is whether these narrowings are important. Not every narrowing needs to be fixed. And we use another new technology in partnership with a local company called HeartFlow, called FFRCT. It's basically a way to use computer modeling to model the blood flow in the arteries. And that helps us decide what we should be doing about narrowings in people's vessels. The image on the right, basically red is bad. And you could see in these arteries that there are a number of branches of these vessels which are red, have reduced blood flow, and that helps us decide that this is a patient who might benefit from a stent procedure or a cardiac surgery. So using these new modalities and using these new technologies like echo and CT, for instance, we can image the heart and provide a way to plan for complex cardiac procedures and give the patients the best possible outcome. Again, thank you very much for inviting me to speak today. I look forward to answering any questions you may have.